If you're over 60, please listen closely. There's a condition that affects thousands of people your age, and the frightening part is you could have it right now without even realizing it. It's called an abdominal aortic aneurysm, or AAA for short. One moment you can feel completely fine, and the next you're hit with the worst pain you've ever experienced in your abdomen. Many people collapse on the spot, and here's the worst part. More than half never even make it to hospital. In this video, I'll explain exactly what an abdominal aortic aneurysm is, who's most at risk, the subtle warning signs that are so often ignored, and the simple test that could save your life. I'll also share the steps you can start taking today to reduce your risk and protect yourself or someone you care about. And if you're new here, welcome to the channel. I'm a UK medical doctor, and I make videos to help you understand the health issues that really matter. So well done for taking this first step in putting your health first. Let's start with the basics. The aorta is your body's main blood vessel. Think of it as a thick garden hose carrying blood at high pressure from your heart down through your chest, into your abdomen, and then branching out to your organs and legs. In most people, the wall of the aorta is strong and flexible, designed to handle that constant flow of blood. But in some people, usually later in life, part of that wall weakens. Instead of staying round and firm, it stretches and balloons out. That balloon is what we call an aneurysm. Why does this happen? A big part of it is wear and tear. Decades of blood pounding against the artery wall slowly break down the structural fibers. Smoking accelerates the process. High blood pressure adds even more strain. Genetics also play a role. Some families just have weaker artery walls, and certain conditions like high cholesterol, hardened arteries, or connective tissue disorders can make things worse. Now, if the bulge stays small, it might not cause any problems, but as it grows, the wall gets thinner and thinner, and eventually, if it stretches too much, it can burst. Imagine blowing up a balloon again and again. At some point, the rubber just can't hold. So who needs to worry about this? The biggest risk group is men over 65. That's why many countries offer a screening program specifically for them. But it's not only men. Women can and do get aneurysms, though they're less common. Smokers are at very high risk, even if they quit years ago. People with high blood pressure, high cholesterol, or a family history are also in danger. And there are people who develop aneurysms with none of these risk factors, which is why awareness matters. Here's the cruel part. Most people don't know they have one. Abdominal aortic aneurysms are often called a silent condition because they usually don't cause obvious symptoms until it's too late. But sometimes they do leave clues. So what should you look out for? The most common is a persistent ache in the abdomen or lower back. This isn't the kind of pain that comes and goes when you twist or bend. It's deep, dull, and nagging. Some people ignore it for weeks or months, assuming it's arthritis or just old age. Others notice a pulsing sensation in the belly, almost like they can feel their heartbeat through their stomach, especially when lying flat. And in some cases, people get unexplained pain, numbness, or color changes in the legs because the aneurysm is disrupting blood flow further down. These signs don't always mean you have an aneurysm. Back pain is common after all, but in the right person at the right age, they should trigger a doctor's visit. Let me tell you a story. I'll change the details, but it's based on a real patient I looked after. His name here will be George. He was 70, retired, and enjoying his time fishing and gardening. For weeks, he'd had this nagging pain in his lower back. He thought it was from lifting pots around the garden. Then he started noticing a strange throbbing in his tummy at night. He brushed it off. Finally, one day, his wife insisted he go to the GP. They sent him for an ultrasound, and there it was. A 7-centimeter aneurysm, so large it was at serious risk of bursting. He was referred straight to the vascular surgeons, had a planned repair, and a month later, he was back tending his tomatoes. Without that scan, his story could have ended very differently. But not everyone is so lucky. When an aneurysm bursts, it's one of the most catastrophic emergencies in medicine. The pain is sudden, severe, and described as tearing or ripping. The person often looks pale, clammy, and confused. They may collapse within minutes as their blood pressure plummets. Even with immediate surgery, survival is low. Around 80% of people with a ruptured aneurysm don't survive, and half die before they even reach hospital. That's why the focus has to be on finding aneurysms before they burst, and the good news is that we can. The test is simple: an ultrasound scan of your abdomen. It's quick, painless, and non-invasive. You just lie on a couch while a probe glides over your stomach with some gel. In a few minutes, the technician can measure the exact diameter of your aorta. In the UK, every man is invited for this scan at 65. In the US, guidelines recommend it for men between 65 and 75 who've ever smoked, and for anyone with a strong family history. Women with risk factors may also be offered one. If your country doesn't have a screening program, you can still ask your doctor about it. If the scan is normal, that's great news. If it shows a small aneurysm, you'll be monitored with repeat scans to keep track of growth. If it's large, surgery will be discussed. And here's where modern medicine has really advanced. In the past, surgery meant a big open operation through the abdomen. That's still sometimes needed, but nowadays, many people can have what's called an endovascular repair. This involves placing a stent graft inside the artery through the blood vessels in the groin. It reinforces the weak spot without the need for a large cut. For many patients, recovery is faster and hospital stays are shorter. Of course, surgery is only part of the story. Prevention is equally important. The biggest step anyone can take is to stop smoking. Smoking damages the artery walls more than anything else. Even if you quit years ago, your risk is still higher, but stopping now can still make a huge difference. The second is controlling blood pressure. High blood pressure puts constant strain on the aneurysm wall. Taking your tablets regularly, monitoring your blood pressure at home, and making lifestyle changes all matter. Managing cholesterol, keeping to a healthy weight, staying active, and eating a diet rich in vegetables, fruits, and whole foods are also vital. These aren't just general health tips. They directly reduce the risk of aneurysm growth and rupture. If you've already been told you have an aneurysm, don't panic. Most small aneurysms never burst, and with regular monitoring, doctors can act before it becomes dangerous. The important thing is not to ignore it and not to miss follow-up appointments. So let me recap the key messages. If you're over 60, particularly if you've smoked or you have high blood pressure, this is a condition you need to know about. Most people have never even heard of it, but it can be fatal if ignored. The signs can be subtle: persistent back or abdominal pain, a pulsing in the belly, unexplained leg symptoms. The solution is simple: ask about an ultrasound. It could save your life. And remember this: catching an aneurysm early doesn't just save your life. It means you get to live the rest of it with peace of mind. If you found this video helpful, please share it. Talk to your parents, your uncles, your neighbors, especially if they're over 60. You might just save someone's life. And if you really want to elevate your health further, watch this video on the top left on more tips on living a longer, healthier life, and don't forget to subscribe.